各位观众，大家好。
Greetings, everyone. Welcome to the Ironclad Irrefutable Evidence Seminar Series. Please don't forget to give this video a thumbs up, subscribe, and share this program. This is a critical issue related to the well-being and security of each individual, every community, and the entire society. Thank you very much for your attention and support. Previously, we discussed what happened after the organ harvesting death camp for Falun Gong practitioners was exposed in 2006. In this episode, we're going to take a look at the signs that showed the continuous increase in the number of organ transplants in China after 2006. For a long period of time, the CCP's deliberate, misleading propaganda created the public perception that the organ transplant industry in China was seeing a reduction in scale after 2006. However, the reality is just the opposite. The number of ward beds dedicated to transplantation increased over years. The hospital recovery time was reduced in order to bring in more patients. The hospital's beds at transplant centers were fully occupied with an occupancy rate up to 131.1%. Some transplant surgeons were busy throughout the entire year. Additionally, considering the consistent short waiting time for organ transplants in hospitals and the evil nature of the CCP, we believe that the quantity of organ transplants continues to increase. All the information we will present to you is backed by archived links from hospital web pages or media reports. 1. The number of ward beds increased and the bed occupancy rate was high. The People's Liberation Army, PLA, number 309 Hospital. The number of beds in the transplant center increased from 316 in 2010 to 393 in 2012. The Organ Transplant Center of the PLA number 309 Hospital was founded in April 2002, and in March 2006, it was officially named as the PLA Organ Transplant Center by the Division of Health of the PLA General Logistics Department. This is a screenshot of the PLA number 309 Hospital's website. It said that the gross income of the hospital's organ transplant center was 30 million yuan, about 3.7 million US in 2006, and then rose to 230 million yuan, approximately 33 million US in 2010, a nearly eightfold increase in Chinese currency in just 5 years. On October 8, 2013, Sina.com said that this transplant center developed from a small unit of a dozen people to a team of more than 300 medical technicians. Tianjin First Central Hospital. The number of beds at this transplant center increased from 120 to over 500 on September 1, 2006. The Orient Transplant Center of this hospital is one of the dominant places for liver transplants in China. The new transplant building of Tianjin First Central Hospital opened on September 1, 2006, with an expanded capacity of over 500 inpatient hospital beds. After the expansion, this center had the capacity to perform 9 liver transplants and 8 kidney transplants simultaneously. It also sent transplant teams to guide more than 50 hospitals across the country to help them perform their first liver transplant, promoting the routine clinical development of liver transplants nationwide. The bed occupancy rate of this hospital was 131.1% in 2013. I have previously explained why the bed occupancy rate exceeded 100%. It happened when the hospital added extra beds for patient overflow in patient units, hallways, or nearby hotels. Shanghai Renji Hospital. The number of beds for transplant patients increased from 13 in 2004 to 110 in 2014. On June 28, 2007, the Chinese Organ Transplant Network reported that the Renji Hospital Organ Transplant Center was equipped with Class 100 horizontal laminar flow operating rooms and Class 10,000 horizontal laminar flow wards, and was capable of performing 6 liver transplant operations simultaneously. Sichuan People's Hospital. The number of transplant patient beds increased from 8 in 2007 to more than 100 in 2011. The hospital established both the Organ Transplantation Research Institute and the Organ Transplantation Center to carry out clinical kidney and liver transplantation in 2007. During that year, it had only 8 beds, 5 physicians, and 5 nurses. As of 2011, this center expanded to have 12 physicians, 27 nurses, and more than 100 beds. Eastern Hepatobiliary Surgery Hospital in Shanghai. The number of transplant beds increased from 712 to 1,500 in 2015. Wu Mengchao is the ex-president of Shanghai Eastern Hepatobiliary Surgery Hospital and known as the father of Chinese hepatobiliary surgery. On May 11, 2011, he and his student, Wang Hongyang, had an interview with a host on Sina.com. When the host asked, "What is the current level of liver transplantation in our country?" Wu Mengchao said, "The number of liver transplants we do now is the largest in the world, and the quality and results are also good, and have caught up with the international level." Furthermore, the average bed turnover rate and the utilization rate of hospitals in China were high. According to Wang Hufeng, the director of the Medical Reform Research Center at Renmin University of China, said that the Class A tertiary top-level hospitals' bed turnover rate in 2013 was so high that Xi Jinping metaphorically commented that these large public hospitals were in a wartime status. 2. China's organ transplant industry has been in a restless state throughout the year. It seems this is neither a short-term phenomenon, nor is it simply isolated cases found in a small number of hospitals. Instead, this is prevalent across China throughout the year. Zhengzhou People's Hospital performed kidney transplantation surgeries every night. According to an article published on the Chinese Etiquette Training Network, on April 8, 2010, Zhengzhou People's Hospital had kidney transplantation surgeries every night before and after the new year of 2007. On December 27, 2007, the hospital completed 13 kidney transplant surgeries within 21 hours. West China Hospital of Sichuan University strategically shortened the transplant recovery time in its kidney division. According to the archived webpage of this hospital, on June 28, 2013, it said, "In recent years, with the advancement of our kidney transplant surgical skills and substantial reduction in complications after kidney transplantation, more and more patients come here for kidney transplants. They have to wait for a few months or even longer, up to half a year, before they can be scheduled for a surgery. Shortening the average hospitalization time, increasing the bed turnover rate, and fully utilizing the available unit beds are effective ways to reduce patients' waiting time." After group discussions and coordination, West China Hospital of Sichuan University improved patient workflow in general care units by shortening medical and surgical treatment time after transplant to 10 days respectively, which decreased transplant patient hospital time from 30-plus days to 20 or so days. Thus, it greatly changed their bed turnover rate. The first affiliated hospital of Zhengzhou University in Henan Province, the number of kidney transplants continues to increase. The kidney transplant department at the first affiliated hospital of Zhengzhou University in Henan Province completed 149, 173, and 230 kidney transplant cases in 2012, 2013, and 2014, respectively. This is just from their report, and the actual number is much higher. On March 27, 2019, Henan Daily reported that the first affiliated hospital of Zhengzhou University completed 13 cases of transplant, including 8 kidney transplants, 3 liver transplants, and 2 lung transplants on March 26, 2019. In addition, we mentioned surgeons at Tianjin First Central Hospital were so busy that they had to work overtime on weekends and holidays to perform organ transplants. We believe that their busy schedules continued after 2006. What we've shared does not describe the full picture of what's going on in China. However, what we can confirm is that the hospitals in China are still conducting organ transplants and are expanding and enhancing their capacity to do so. All this is true even after some policy changes that seemed to limit the size of the transplant industry in China. The purpose of these policy changes is not to help regulate the transplant industry in China, but instead to create a facade for the industry's expansion and the ongoing crime of live organ harvesting. Please continue to watch Episode 11, another promotion of free liver transplants in China. In particular, please note that this is a worldwide unrestricted war without gunpowder. The CCP's crime of live organ harvesting from Falun Gong practitioners not only continues, but has spread throughout society. For example, in 2013, a 6-year-old child, Little Binbin, in Shanxi, went missing. 2 days later, he was found with his eyes gouged out for his cornea. Dozens of university students in Wuhan disappeared for no reason in recent years, and countless children and women go missing every year. Live organ harvesting has become a threat to everyone. Perhaps, as we are talking, many kind and innocent people are being put onto operation tables for their organs. And also, many have been detained in dark prisons for many years, and their hearts, livers, and kidneys are waiting to be excised in an indescribably cruel way at any moment. How urgently they need rescue from the outside world. How excruciating it is for their parents, brothers, and sisters to bear the pain of missing their loved ones for years. Live organ harvesting signifies an unprecedented atrocity that has never existed on this planet. We cannot heartlessly ignore the fact that the Chinese Communist Party is ravaging and killing people. We cannot watch the CCP flagrantly destroy the bottom line of morality with lies, coercion, and financial lures that aim to silence and lead the entire human race to fundamental destruction without taking action. We urge everyone to like, subscribe, and spread the word about our program. Let your family, relatives, friends, neighbors, co-workers, and anybody else in your social circle know the facts of the CCP's mass organ harvesting from living Falun Gong practitioners. Please tell the whole world the truth and stand together to put a stop to the CCP's crimes against humanity. This is a critical issue related to the well-being and security of each individual, every community, and our entire society. Thank you very much for your attention and support.
感谢各位朋友，感谢大家的关注支持。
World Organization to Investigate the Persecution of Falun Gong, WOIPFG, was founded on January 20th, 2003. It is based in New York with branches in Europe, Australia, Asia, and Canada. WOIPFG's mission is to investigate the criminal conduct of all institutions, organizations, and individuals involved in the persecution of Falun Gong. To bring such investigations, no matter how long it takes, no matter how far and deep we have to search, to full closure, to exercise fundamental principles of humanity, and to restore and uphold justice in society. The principle of our investigation holds that those who have committed crimes shall be brought to justice. Individuals shall bear the same responsibility for their involvement in their organization's crimes, and those instigating the persecution shall bear the same responsibility of those who have physically carried out the persecution. We intend to uproot state-sanctioned crimes and safeguard human morality. The criminal conduct of all individuals within organizations, units, and departments involved in the persecution will be thoroughly investigated and brought to justice.